And then there's other pathways that are important. The vitamin D receptor pathway, that's very important for patients. If they have a lot of defects in that pathway, they need to maintain, in my book, they need to maintain a higher vitamin D level than clinically, what would be considered clinically normal. There's cell membrane protection genes. This can lead to cancer. This is a very important gene right here, the sex hormone binding globulin gene, for women especially. So women in their teens and 20s that have a defect on this gene are going to be much more susceptible to menstrual issues, PMS issues. If you have a double allele defect, the chance of you having ovarian cysts and breast cysts is much greater because it affects your ability to hold progesterone. So you have progesterone issues. It's actually quite treatable. So knowing that you have that gene, knowing that your 8-year-old girl has that gene, you can really help prevent a lot of stuff with her. So that can be really helpful. And every woman that I've ever tested that has that gene defect, and I mentioned just what I said, goes, oh my gosh, I've had, you know, I think every woman that I've ever tested, I've had ovarian cyst problem. I had the worst PMS issues when I was, so I think it's very clinically relevant.
Does a single mutation do it, or just
single mutation is going to increase the risk of it. And then this iron oxidation panel is really, I think, important. This person doesn't have a lot of defects there. Is very important, and that's something that's really high with Lyme patients, is this iron oxidation panel. Their iron is being oxidized, so they have symptoms of anemia, and the worst thing they can do is go on more iron. So it's being oxidized. So there's some specific nutrients that you can help with that. So that is an extremely helpful clinically, symptomatically. That can cause the majority of a person's symptoms too. With cancer patients, we almost always see MUTL homolog gene defects. So those are some of the things that are common with cancer and not common with Lyme, vice versa. Those are DNA repair genes. The urea cycle I just mentioned in passing before, but that's how you get rid of ammonia in your body. So if you're producing excess ammonia with CBS defects, that's the transsulfuration pathway, you're not getting rid of it through the kidney very well, you're going to have excess ammonia issues. Also with especially the ALS gene, I think it is, in here, you will have an increase in your risk of kidney stones. So you got to make sure that you're staying hydrated.